Hello, everyone. Hello, hello, hello. My name is Bob Miglani. Welcome, welcome. If you are doing dry eyes, if you're a doctor doing dry eyes and you want to get more signups, if you're frustrated with only getting 1 to 2 signups, you're at the right place. Hello, everyone. My name is Bob Miglani. I'm going to walk you through how to close. Yes, we're talking about closing techniques today for dry eyes. So you don't just get 1 to 2 signups a month, you get 4, 5, 6, 7, 8, 9, 10. You get lots and lots of more signups because more and more patients have the problem. But the issue becomes you don't know what to say. You're not comfortable with how you say it. So we're going to go through all of that. We're going to answer your most important questions also on this stream today, on this live stream. All right. So today I'm joined by who's folks? Doctors who are at the Facebook group, the Dry Eye Doctors Facebook group, the LinkedIn, and others who are streaming on different devices. My name is Bob Miglani. Hello. We're going to get started in just a second. Let's make sure everyone's on. And if you want to comment or ask a question, drop it in the chat. We'll make sure that my colleague Amanda is going to answer those or get me to answer those questions for you. And we're going to get started. So I'm very excited today because I love sales and I love marketing. And I'm going to get to share what I've learned over the last 20, 30 years in sales strategies to help you, the doctor, close more for dry eyes. All right. So I'm going to walk you through this presentation. Please do stop me if you have any questions. I want to make sure that I'm thoughtful about taking questions at the end, but I want you to also drop them in the chat. Okay. I want you to drop them in the chat. So I want to make sure we answer those questions. All right. So let's go into what's going on today. Let's present. Amanda, are you ready? Yes, she is ready to go. She says yes. She gives me the thumbs up. You can't see it, but she's lovely and she's going to give us the thumbs up. All right. Can you see my screen okay? Yes, Amanda. Yes, you can see my screen okay. All right. Wonderful. So hello, everyone. My name is Bob. I'm going to walk you through how to close dry eyes and get more signups for dry eyes. Okay. So how do we do that? So number one, the outcome today is I'm going to show you an ideal process to close higher. I'm going to show you the ideal language to close higher. And I'm going to show you why this all works. Okay. Understand the core reasons why it works. Okay. So patient comes in, they have dry eyes. You get excited. Yes, I get to sell. No, said every doctor, never. Okay. I get to use my beautiful IPL and RF device. Hey, patient, I caught the problem. Chief complaint is dry eyes. Yes, I'm super excited, right? And then you start explaining dry eyes, MGD, tear film, lipography, technology, equipment. It's amazing. It's $1,600. You start explaining all of that. Sorry. And you say it's out of pocket. It's not covered. Let's get you scheduled. And so you're thinking in your head, I'm just going to talk to you about my new instrument that I've got. And I'm going to close you today, right now, because you've got this problem. I know you suffer from it. I see your glands are poor. I see you might have symptoms. You explain a little bit that you have symptoms. And so I'm going to close you right here. I'm going to be great at it. And the patient is thinking, what you talking about, doc? Right? There's like, hey, I just came in for an eye exam and glasses. I got to go back to work. Is she trying to sell me something? Why can't I just get drops? I got to talk to my husband and wife to clear this because it's $1,600 cash or whatever it is. And is this procedure going to hurt? Do I need to take a Xanax before I get the procedure, this quote unquote procedure? And how come I have never heard of this before? So patient is suspect and suspicious about what just happened because their expectation was, I'm just going in for an eye exam and glasses, right? And so your dilemma as a doctor is you want to help, you see the need, you want to do this specialty, you want to get away from $40, plans and find a way to make more money and have more profitability in your practice, in your business. Unsure when you're presenting, and how should I be even pricing this? What do I say? How do I sell without being salesy? And the truth is you're losing a lot of potential revenues if you don't figure out an approach or a solution to this problem. Okay. And just an example with 15 patients at $1,600 for, let's say, an IPL you're losing $24,000, and that could be per month. I don't know, 15 patients a month may sound like a lot, but it's actually not, given that so many patients have dry eye disease, right? And so I understand your problem. My wife and I, Shefali is an optometrist, and many of you may know the story, but I worked at a company called Pfizer many years ago for about 20 years. And so I'm in marketing and sales, and Shefali is the optometrist, and she had the same problem in her clinic. And so we put our heads together and we created a solution. And so she was really, busy, not fulfilled, and really glued to the practice. And she wanted to pivot out into specialty care, into myopia, for example, as well as dry eyes. And so we worked really hard. We tried a lot of different things, and we worked together. And look at this young guy without a beard. My God, look at that handsome young man. I'm just kidding. I don't know if I look better with a beard or without a beard. Okay. That's a question for you today. Okay. That's a question for you. Better with a beard or without a beard. Okay. But we worked together and we found a solution, and we call this the Hoot method. And one of the most important things we learned today, and I'm going to share with you, is that business, and this is a game of psychology, and we must master our own psychology and our language to help patients to move forward and sign up. So this is not about the instrument. It's not about the beautiful treatment. It's not about glands per se. This is a game of psychology. And I call it a game because, and not to belittle this, but the idea that what we're talking about here is all about psychology, right? This approach is got to take a psychology approach to it. And here's why. So let me just share with you some of the reasons sort of why. First is that patients used to listen to you. Well, today, they don't listen to TikTok. 20 years ago, you used to go to the doctor told you what to do, and you listen to him or her. Today, TikTok and other social media and other places are educating patients about dry eyes. You are not, because you're cramming the comprehensive exam. So this is a quick video. There's so many videos on TikTok today that educates patients. So patients actually search, not on Google per se, but on TikTok. Remember, these social media platforms are search engines. And so no longer are patients relying solely on you, who's rushed, busy, don't have time to explain, and they're relying on social media to get their education. And then when you get home, when the patient gets home, right, they want to share. And when healthcare decisions are made, typically after 9:30 p.m., the kids are in bed, and the adults are on their phones watching TV, watching Netflix or whatever, or Instagram, and the spouses are talking to each other about their day. That is when healthcare decisions are made. And so if you want to influence healthcare decisions by your patients who have dry eyes and close, you must live in their kitchens and in their bedrooms. And I mean that in a way that's digital. You need to live there, because that is where you get to influence and shape their opinions. So as they move forward to treatments, a lot of these patients need treatment, but they don't get it because you're not educating them. And so that is that's really, really powerful, is that you need to live on their phones. All right. So one of the, so there's one, these are all ones. Okay. These are all ones because they're all important. Okay. We learned basically three things. You've got to have a clear process. You've got to have better language, and you've got to send videos on their cell phone. So I'm going to walk you through what that looks like. And then I'm going to share with you some really powerful language techniques to help close more dry eye patients. Okay, I'm going to walk you through some of that language. All right. So closing begins in the comprehensive. And I don't mean you close them there. What I mean is, in order for you to close, you've got to have a clear process. And the process must have more than just one thing. And what I mean by that is, you can't just have one conversation in a comprehensive exam and expect to close, because people are overwhelmed. Like I said before, they're just overwhelmed when they come in for a comprehensive exam. And therefore, when you're talking so much about a disease they never heard of before and solution they never heard of before. I'll give you an example. There's a doctor we work with, and she's wonderful. And she said, Bob, I know you tell us don't cram the comprehensive. I did. We had a paralegal in our chair, and she was diagnosed. She had symptoms. I told her about the IPL, and she said no. She went home, wrote a 1-star negative Google review that stated, the doctor sold me $700 glasses. Then she told me about a disease I never heard of before. I had no symptoms, she claimed to not have any symptoms. And she said, and the doctor magically had a solution that cost $2,000. Don't trust this doctor, never to go see her again. People don't close, they don't convert, they don't close, they don't convert in just one setting, especially for something that's $1,600, for example, right? So you need to have 7 touches in sales to build trust and convert. So closing begins in the exam room, in the comprehensive exam, with the words you use. I'm going to walk you through what that looks like. But the most important thing is that you need to break this up. You need to lengthen the runway of education in the comprehensive and the consultation and the treatment. And I'm going to show you what that looks like. Okay. The second thing is you've got to use clear language. All right. Now it's really important. So Don Miller wrote this book called Story Brand. And in that, it's a really great messaging strategies book. What he says is a couple of different things. When you confuse, you lose. People are drawn to clarity and away from confusion. And so it's really important that you follow the following, descriptions here of how to use clear language. First and most important thing, no one cares about your solution. Yes, no one cares about the $120,000 you spent on your InMode, or $100,000 you spent on your OptiLight, Luminous OptiLight, or $80,000 on this IPL, or $70,000. No one cares about your solution. Human beings are selfish. We care about our own problems. So people care about themselves. So you must talk more about their problem, 75% about their problem, and 25% about their solution. So it's really important that you understand that the problem is the way you see it are glands. The way they see it is screens. And so you must speak to them about their behavioral changes that's happened, especially since COVID, when we're all glued more and more to our screens. And what that results in is fewer blinks, and less blinking means the glands are not utilized and they get clogged and they get hardened oil, and therefore eventually the glands will atrophy. So you must speak very, very specifically about their problem in the comprehensive exam. Do not talk treatment. Don't talk treatment. If you talk treatment, it's magically she had a solution and all of a sudden it's $2,000. What? No. You're going to go down a rabbit hole of solution, and they're going to be like, Doc, you're just trying to sell me something. I'm so out of here. So increasingly, you've got to remember people care about their problem, so focus on their problem. Use a script, and we give all of our doctors a very specific script that we go through on our training classes. And one of the biggest things, and we had a call recently with Dr. Cohen and Dr. Chapman, phenomenal optometrist, really, really good. And the word that Dr. Chapman specifically said she loves to use is "I'm concerned." Mr. Jones, we did a diagnostic on your comprehensive eye exam today. We found that there are these glands underneath your both upper and lower lids called meibomian glands, and we found that they are the glands are hardened. And I'm concerned. What's happening is we're using more and more screens. How has your behavior changed over the last few years, Mr. Jones? Are you watching Netflix on your phone when you go home or after work, or are you on screens a lot? Yes, doc. Guilt. Patients are feeling. Yes, I feel guilty. I'm on screens all the time, doc. Really? Tell me more. How much are you on? Are you on in the evenings? Are you doing FaceTime? Is your battery run out on your phone? It's 7 p.m. because you're on screens all day long? Yes, doc. Well, what happens is we're not on our screens. We're not blinking enough. And therefore, we're not producing that beautiful, healthy oil. So remember, that's something that patients care about. Their screen time. They care about their own behavioral change that's led to this problem. So that's a good dialogue. Just think about it. That's about the patient, not about you and your device, right? So use clear language. I'm going to go into this a little bit further in more detail. And for you've got to use video. Videos transfer so much knowledge in a very short amount of time. and they see your face. And so humans buy from humans, not from brochures. Remember, with videos, patients are 4 times more likely to buy, and you are being seen as an expert when you use video. So send them videos, and this is just examples, some screenshots. So how's it going to work in your practice? What's the language, and how do you close, Bob? All right. So are you with me so far? By the way, I just want to make sure you're with me. I want to make sure that I'm answering the right questions. Amanda, are we good so far? Maybe you could just give me a chat and thumbs up and let me know, folks. Are you paying attention? Does this make sense to you? Okay. Is this cool? Is this kosher? Are you listening? Are you hearing me? Are you does this make sense? Give me a thumbs up or give me something that says, hey, Bob, you're on the right path. Keep going. Yes. Amanda, yes. Good. I'm going to hear from her any second now. And she's going to type it into the thing. Are we good with the recordings? Yes, we are. Okay, good. All right. So we're going to go further. All right. Let's go further. So next, how's it going to work in your practice? Okay. So how's it going to work in your practice? Let's go into that further. So now in your practice, let's talk about how you close and how it works, what the language you're going to use. So in the comprehensive exam, what you're going to do is essentially the language to use is to make the diagnosis. And you want to make the diagnosis as much as you can, if you can, either with testing form and function, squeeze a little meibum, maybe do meibography. Very important to have an objective clinical assessment. Okay. When you have an objective clinical assessment, a scan, for example, of meibography, or you prod and you test the form and the function of the meibomian glands, you can then educate them. Mr. Jones, today we did a scan of under your eyelids, and both upper and lower lids, and we just lower lids. But you've got these things called meibomian glands, beautiful piano keys, and you can give them a handout and show them what these piano keys look like, these glands look like. Well, guess what? We're on our screens all day long. We're not blinking enough. And we're not blinking enough. We're not producing that beautiful, healthy oil that coats our eyes. When we blink, it's a natural process to put that film over our eyes. And that gives us clarity of vision and so many other beautiful things. When we don't blink, our glands get clogged with hardened oil. And then over time, when you close your eyes, when you blink, it's like sandpaper, and it's really uncomfortable, irritating, and it's not good. I'm very concerned. If you continue on this path, it's going to get worse, and drops are not so again, important in the comprehensive exam to become some sort of a mind reader. I'm going to talk about that in a second. But essentially, you only want to diagnose in the comprehensive exam and express your concern and say, look, this is not normal. It's getting more and more problematic for so many patients, but this is not good. I'm concerned about it for you. I want you to come back and see me in about a week. Okay. And then what I'm going to do is I'm going to send you some videos between now and then to educate you at home about what this problem is. Okay. Because I want to be respectful of your time, and I've got patients waiting as well. But here's the skinny. And the bottom line is your glands I suspect you have something called meibomian gland dysfunction. I know it's a big word, but essentially means the glands are possibly clogged because of a lot of screen time that you might be on. We can't just wish it away. And you're probably wondering, doc, I don't feel anything. I don't feel these symptoms. And the answer to that is that you're right. You won't feel anything until it's too late. And increasingly more and more of disease today, we don't feel hypertension, high cholesterol, right? Do we feel anything? No. But underlying inside, we've got inflammation and problems. So I want to go a little deeper. So I'll see you in about a week's time. Come back and see me, watch the videos, and really just do me a favor. Please do me one favor. Do me a favor. Go get a glass of water when you're on screens all day long, and not to hydrate yourself, but so you blink, for crying out loud. So be helpful, be thoughtful. All right. Now what's going to happen is at home, the adults are in bed, and what happens? They need to get permission. Men, I'm a guy, right? I need to get permission from my wife to spend money. Okay. And so at home, when your patient is sitting with their spouse in bed, and they say, what happened to the doctor today? There could go two ways. Well, the doctor told me I need to, blink more and, stay off screens a little bit. And she wants me to come back in a week. There's something wrong with the eyes, something got inflammation. I don't know, the lids or something. And I don't know. I got to go back and see her. And oh, really? Is there a serious? Well, I'm not sure. She wants me to go in. Come back and follow up. Okay. Well, do you trust her? Yeah. You go back. Okay. So you go back. That's how human beings talk, folks. This is a typical conversation with a husband and wife talking about what happened at the doctor. The alternative is, hey, what happened today? Well, I went to see the doctor. She told me I had this problem. And then, then there was this procedure that was like $2,000. What? You mean do you feel bad? Do you feel anything? No, I don't feel anything. But why is she selling you a $2,000 procedure? What's the deal? Well, I don't know. I mean, that seems a little suspect, a little sus. And you're supposed to go back. What are you supposed to do? Well, I'm supposed to go back and see her. But, I think she's going to probably try to sell me on this thing. Well, do you need it? I don't think I need it. We'll just cancel it. Cancel the appointment. Folks, this is real conversations. And that is what happens with patients at home. And what do you want? Scenario one, where the spouse said, yeah, go back and see the doctor because she's trying to tell you something. It might be wrong, right? Versus, hey, cancel the appointment because she already told you the price. She's trying to sell you on a treatment, right? So guess who's going to go back? The patient where the doctor expressed concern, made a diagnosis, and just wants to educate and help that patient, right? If you think they're going to come back to see you if you already talked about $1,600 or whatever in the exam room, rarely. It's rare. So the show up rate declines, folks. So it's really important that the language you use, and that's going to help you convert more patients. So this is, our Hoot campaigns that go out automatically. It's automatic messages go out. It's just a week and it's 3 messages, 1, 2, 3. The first is an email. It's a summary report and it just summarizes what happened in medical assessment report. It's automatic. You don't have to fill anything out. The second is a video 1, video 2, and then just a couple of other videos on day 7. This is called drip marketing and it works really, really well because people are fresh. It's in their mind right here on day 1, right? You just left the exam room. That day, you're getting this message says, hey, here's a summary of the report. Patient's like, cool, this doc has their act together, right? And then the message is to promise to educate. You promise to educate. Here's the education. And then they show up for the ocular surface evaluation. They come in pre-educated, as some of our doctors like to call it, pre-educated for you. And then when they come in for the ocular surface evaluation, you're going to use visuals. Remember, people want to know keywords so they can tell their wife about it or their husband about it, right? So they want keywords to remember, and they will remember it when you use visual aids. People remember 30% of what you say, and then 70% of what you say and show them. So show them visuals. It's very important to educate, okay, in the consultation day, which is the ocular surface evaluation day. And then these campaigns you can send out automatically. It just gets them informed about what an IPL is and everything. Now let's kind of summarize here some of the key things, key points in closing techniques. All right. So in the comprehensive exam, you've talked to them, educated them, brought them back. Now let's go into the ocular surface evaluation, which we're calling consultation day here. What you're going to do is you're going to do your tear breakup. You're going to do Inflamadry. If you do that, a lot of doctors, best practices, really successful practices do Inflamadry because it's an objective clinical assessment of dry eyes, right? And so what you're going to do is then now you're going to educate the patient, okay? After you do the testing, you're going to educate the patient and you're going to move into the education part of it and the sales part of it, okay? Which is, Mr. Jones, I confirmed the diagnosis. You indeed have something called meibomian gland dysfunction. Probably watched a couple of videos we sent you. And I want to just talk to you about some of the therapies that are available. I'm going to prescribe for you. All right. So number 1, I'm going to prescribe you, let's say omega-3s, really important to loosen up that hardened oil. I'm going to prescribe you warm compresses. I'm going to prescribe you some drops just to, help you get some symptomatic relief. And then I'm going to prescribe you, let's say an RF or an IPL. And then I'm going to show you what that looks like, Mr. Jones, so you understand what it is. And these procedures are in-clinic procedures, and you don't have to, you don't need anybody to drive. They're about, 20 minutes or so. I'm going to send you a video about what these procedures are. But this is a customized plan for you, Mr. Jones. And I think it's going to really work to help get those glands functioning again. So remember, what you've just done is, let's pause for a second. What have you done? testing and start educating broadly about the whole gamut of 3 or 4 things that you're going to prescribe them, not recommend. We don't recommend. Recommend is too soft. You are doctors, and you need to be clear when you explain things to patients. And clear, remember, people are drawn to clarity and away from confusion. Recommend is confusing. What do you want me to do, doc? Tell me what you want me to do. Well, I'm going to prescribe you this, that, and the other. Okay, that's my prescription. I'm going to do that. That's clear. So when you prescribe things to them, so again, you're going to prescribe it, and then you're going to get into the objections. And in this case, when they're sitting in your chair now, after you've explained and shown them the visuals and you've shown them what an IPL looks like, you're going to become a mind reader. Now, when the patient is sitting in your chair, this is your really, really strong closing techniques, okay? Strong meaning effective. They're not pushy. Remember, we're not here to push anything, okay? You need to bring up objections they are thinking, okay? So you've got to use a bridge word, a phrase. And I'm going to give you this one. You're probably wondering. So patient sitting in the chair, you went through everything. What are they wondering? Why can't I just use drops? Like, what's the big deal, right? So you're going to say the following. Mr. Jones, you're probably wondering, why can't I just use drops? And the answer to that is because drops don't get to the root of the problem, which is inflammation, okay? Drops just give you symptomatic relief if you have symptoms. And that's why at CVS and Walgreens, you see those aisles and aisles and aisles of drops, because people spend thousands of dollars in a year or, over time on just getting drops over and over and over again. But they don't get to the root of the problem, which is inflammation. And so that's why you can't use drops. And then you're probably wondering, hey, doc, why should I do this procedure when I don't feel anything? And Mr. Jones, you're right. You're not going to feel anything right now because we're seeing the underlying condition. Most disease today, you don't feel anything until it's too late, such as hypertension, high cholesterol, right? Just 2 examples. We all know, Mr. Jones, people in our lives who said they were feeling fine. They didn't feel anything. And then they had a heart attack. And that is something we're trying to avoid. Look, what we want you to do is to keep your glands healthy for your life. Once they're gone, they atrophy, they're gone forever. They don't grow back. Okay. So you should do an IPL because the underlying inflammation is present. It's there. Okay. Just because you don't feel anything doesn't mean disease doesn't exist. It exists. It's in your eyelids and it's going to get worse. All right. Then the other question a lot of people have is hey, how much is it going to cost? Does insurance cover it? So these are bridge phrases. So again, you're probably wondering, doc, does insurance cover it? And what's the damage? How much is it going to cost me? Right. And so the answer to that is, Mr. Jones, no, the insurance doesn't cover it. And it's about $400 per treatment. You need, I think, about 4 treatments. And I think it'll be very useful for you this year. So it's about $1,600. Insurance doesn't cover it. And people need to know why. Why does insurance cover it? Okay. So what you're going to say to them is insurance doesn't cover it because insurance companies have yet to catch up with some of these new technologies for problems that just started happening in the last few years. Post-COVID, especially post-COVID. We're using our screens a lot more. So these are new problems. And so insurance companies haven't caught up with that yet. In fact, it took them 20 years to cover mammograms, right? It took them a long time to cover mammograms. And so, and then you're probably wondering, doc, is it worth the money? Now, you don't have to say all of these 4 things, but 1 or 2 I think is really powerful because it lets the patient know this doctor knows what he's doing. This doctor knows what she's talking about, okay? And you have to be a mind reader. This is about psychology, folks. Don't sell the IPL, sell the problem. So the question you're probably wondering, Mr. Jones, is it really worth the money? And, I believe so because I'm concerned if we leave this alone, it's going to just continue and get worse and worse. And I really would rather have you, to take care of this now rather than spend thousands of dollars going to Walgreens and getting those drops all the time. So, and I think this is the right thing to do. So you got to give them permission. You got to give them permission. You're doing the right thing. People need your permission to move forward because you're the doctor. So what happened? What happened? You closed. You closed effectively. And as I said, yes, I'm going to sign up. Let's get you, Judy, get you scheduled. Let's get you scheduled as soon as possible. Yes, doctor. Did I answer all your questions for you, Mr. Jones? Yes, you did. Thank you, doctor. And then they're going to move on to schedule it. If they don't schedule it today, what's going to happen is your staff's going to call them the next day and they're going to say, doctor would like to schedule you. If they say, no, I want to think about it, then what you do is you activate what we call a nurture campaign that sends them videos about eyelid hygiene, drops, omega-3s, etc., home care instructions, right? So we want to be thoughtful about what we send them. We don't want to always push the IPL or RF or any of these devices. We want to be thoughtful about what we do. All right, so that's that's my presentation. Just some quick tips I want to share with you. Hopefully this is helpful, okay? Hopefully this is helpful to you, right? If you have a question, please post it on the comment. This is the time to put those questions in. And I want to just remind you, closing techniques, you cannot have an effective close, okay? You cannot have an effective close unless you've had a process that lengthens the runway of education. You can't close in the comprehensive exam, folks. It's overwhelming for patients. It doesn't build trust, and the patients suspect you're selling something, and you get desperate, and that is terrible. So it's really, really important, folks, that you lengthen that runway of education. You have a meaningful conversation in the comprehensive visit. Diagnose, talk about screens, not your device, okay? And then bring them back to follow-up, and then do the diagnostics, educate, and then close. Effective closes are when you've educated and touched the patient multiple times, either through video, a handout, or a meaningful conversation in the front of the funnel, okay? I know this is sales language for you, but it's really effective and it works to close more and more patients. So stop saying no to 1 to 2 signups a month. You've got a lot of potential in your practice. You need to get to 5, 10, 15, 20 signups a month for your IPL, RF, or whatever device, or LLT, what other device you have, and your treatments you had. All right. What questions do we have? Thank you, Leslie. That was nice of you to say thank you. Clapping. Thank you. I appreciate that. Thank you very much. I'm so grateful. What questions do you have? Is this useful? Talk to me about any issues. All right. So how soon do you see them for a follow-up? Here's a question. All right. So the follow-up, what you want to do is have them within a week. This is a hot lead sitting in your chair. What happens, folks, when you have a hot lead and time? They become cold. And also, lives are busy. So have them back within a week, okay? So between the comprehensive and the ocular surface evaluation should be a week. Any more than that, a doctor said to me, Bob, I love what you say. And down here, and they were in Texas, I think it was. And it's like, down here we say, what happens with milk when left out too long? It gets spoiled. So your patients are like milk. If left out too long, they will be spoiled. They'll be forgotten. Okay. So Caroline, who asked that question, if you want them back within a week, okay, and the week is really critical because 10 days max. Because the longer you wait, guess what? They don't feel symptoms, and they don't feel symptoms. They think, oh, I got a dry eye follow-up. I don't have dry eyes. Do I have dry eyes, honey? No, you're fine. You don't complain. Okay, well, then I'll just cancel the appointment. They will cancel your appointment, okay, if you leave them out too long. So you've got to bring them back within a week, okay, Carolina? Hopefully that's helpful. What other questions do you have for me? Talk to me. What other questions hopefully that was helpful. Week is typically, really good. Let's see here. What else do we have? What other questions? Somebody's asking about language that the staff. So staffing. So someone's saying, well, should the staff close or doctor? No, you've got to help the staff. You've got to help the staff close. If you've got a great patient coordinator, amazing. Definitely do that. Have the staff, close them. But I think the patient wants to hear from the doctor why they should do this. You got to tell them. You're probably wondering why I got to do this, doc. And the reason is because I'm concerned if you leave this alone and the way that you're using your screens, it's going to get worse and worse. And then your glands are going to be, atrophying, and they're going to fall off and they don't grow back. And so what we really want is to nip this in the bud, Jake, Mr. Jones, and I want to take care of this right now for you. So, let's get Julie to schedule you. So you need to hand off in a thoughtful way to your staff. Don't rely only on staff to close. I know a lot of you are like, Bob, I'm fee phobic. I can't present. No, you're educating them. I had a wonderful podcast interview recently. You've got to listen to this podcast. It's dropping today. It's called the Marketing for Doctors podcast. I had Dr. Kim Friedman on. She is spectacular. You've got to listen to that podcast. Go on Spotify or Apple Podcasts. It's called the Marketing for Doctors podcast. And on that podcast, she shares really specific strategies on dry eyes and how she built her clinic with zero external marketing for 30 years, 6-partner practice. Okay, huge practice. So it's really important for the doctor to say some words of encouragement to give the patient permission to move forward. All right. What are the other questions you have? So staff, yes, staff are important, but not like you. You are more important. And so having a phrase, a few words of encouragement to encourage that patient to move forward is really, really powerful. Okay. So yes, the podcast is there. Hannah, share the Apple link, because the Buzzsprout just goes to whatever, but it's really important to share the Apple link, the Apple podcast link, or the Spotify link. Okay, so we can share that. That would be great. That's the podcast. Listen to that podcast. All right, one other question we have is, how do I learn more about these videos from Hoot? Book a demo with Hannah. I think she gave the link to you. You go to gethoot.com and we'll show you. And these videos, by the way, are of you, the doctor, educating the patient throughout their journey. And so we shoot you on a Zoom call for about 20 minutes, ask you a bunch of questions, and then those videos go out. And what that does is build a bond and trust between you and the patient. Folks, what this is about is the trust. More and more patients are losing trust in doctors because of time. You don't have time anymore. They don't have time. And so what this is intending to do, the video is intending to do, is to take that time you used to have in the exam room and bring it to the digital device. That's what we're trying to do here. It's not Hoot who's converting. It's you. It's your face. It's your education that you're giving to patients. And that's what patients want today. They want you. So let me close by saying, look, 40% of patients who typically come in have some sort of dry eye disease increasingly. And this is kind of what we see across the country because of devices, right? And kids as well. And so you've got to make sure that you take advantage and you help those patients and also help your practice. Okay. You've got to help your practice grow and capture that hidden revenue. Okay. Stop spending money on Google ads. Stop spending money on Facebook ads, and stop spending money on brochures. They don't work. My wife and I, we tried all of that. So what we want to try to do is to really help you grow your business. And I believe the next 12 months are going to be great for you. You just got to learn, to understand, to shift some behaviors and really get going really fast, right? Start somewhere. And we'd be happy to work with you to start. So anyway, hopefully this has been helpful. This is Bob Miglani. I'm going to sign off now. To get a hold of me, bob@gethoot.com. Again, bob@gethoot.com. Please send me an email. I'm happy to speak to you or answer any of your questions independently. Thank you so much for your time. Have a great rest of the day. Have a good day. Bye, everybody. Thank you. Bye. Bye, bye, bye.